Hi there, so this is my recording for an APGAR assessment. The APGAR is performed at 1 minute and 5 minutes post-birth to indicate whether a baby needs further monitoring or treatment. So first I'm going to look at the appearance, and because this baby is pink all over, I'm going to give her a score of 2. If she only had a pink torso, it would be a score of 1, and if she was pale or blue all over, it would mean a score of 0. So next is checking the pulse. As it is over 100 beats per minute, again, it's a score of 2. If it was under 100 beats per minute, it would be a score of 1, and no pulse is a score of 0. So next up is checking the grimace aspect. One method is to gently pinch the baby's cheek. As she pulls away from this pinch, the score of 2 is given. But if it was a weak grimace, that would be a score of 1, and no response would be a score of 0. And looking at the activity aspect, looking at the muscle tone, there is some flexion of the arms, so I'm going to give it a score of 1. If the legs were to resist exertion, she would get a score of 2, and no activity is a 0. So last is checking the respirations. This baby has a very strong cry, so she's going to get a 2 on that score. If it was a weak cry or some gasping, it would be a score of 1, and no respirations would be 0. So the APGAR score here after 1 minute is 9, which is generally normal. 4 to 6 is fairly low, and anything 0 to 3 is critically low. I will again perform the APGAR at 5 minutes post-birth. Thank you.